Ladies and gentlemen, I'd like to talk to you about this skull vibration induced nystagmus and its neural basis. I don't have much time, but you can find the details in this paper, which is published in Audiology Research. It's open access, and I draw your attention to it. So, what is it? It's a very fast, simple test giving information about the functional asymmetry between the two vestibular systems. I'm going to use an example of someone who's had a total unilateral loss, but who has compensated. So not in the acute stage, the kind of person who comes into your clinic with some kind of compensated problem. Different pathologies cause different patterns of vibration-induced nystagmus, and you can read about in the many papers by Georges Dumas, or the big review by Dumas in 2017, or in my paper. What is it? Well, the stimulus is very simple. It's 100 Hertz vibration. 100 Hertz is about optimal, on the mastoid for about 5 or 10 seconds. It's got to be moderate intensity. It's not some feeble little thing. It's got to be pretty strong stimulus, but it's very short lasting, and the situation must be vision denied using video techniques or Fresnel glasses to look at the eye movements. It's very fast, innocuous, with minimal equipment, and what clinicians see are the quick phases of nystagmus, because the slow phases induced by this stimulus in patients are usually pretty small. I draw your attention to one simple physical fact, and that is the vibration of one mastoid stimulates both labyrinths about equally, because that vibration is transmitted very effectively through the skull. So, what is the response to this vibration? Well, you can see it over here, this nystagmus, which starts at the very onset of the stimulus and goes through to the offset. It's stimulus locked. But when you do this in healthy subjects, they show just about nothing. Patients with unilateral vestibular loss, however, show this nystagmus, which is stimulus locked. It's mainly horizontal, low only about 10-15 degrees per second, although faster in some cases. Most importantly, with quick phases directed away from the affected ear. It is also stimulus locked, starts exactly at onset, finishes at offset, and very little adaptation. And notice it's got components that are both horizontal and torsional. And both quick phases are directed away from the affected ear, but there's very little vertical component, as you can see here. And most surprisingly, you get the same direction of nystagmus for stimulating either mastoid. Either one. How can neural data explain this? Well, I recorded from single nerve cells in anaesthetised guinea pigs and stained them, so you could see they really did originate from the horizontal canal ampulla, or the canal ampulla. And I also tested them out with rotation, so you could see these really were horizontal canal, these really were canal neurons. Some of them were horizontal, some of them are anterior. And these were irregular neurons. They've got irregular discharge at resting, and they respond. They're activated by 100 Hertz vibration. Not all of them, but enough. And this is the kind of example I'm talking about. Turn the stimulus on and you get these action potentials generated each time the stimulus is presented. Increase the frequency and you can see that you get a poorer response. But one of the most important aspects of this vibration response is that the response, the action potentials are locked onto the exact waveform of the stimulus. This is called phase locking, and you can see this neuron generates one action potential per cycle. That's true up to 100 Hertz, and in fact, it's got the consequences you can see here that when you turn the stimulus on, here at low intensities you get some kind of activation, you can see the pretty regular spacing. Here, as you increase the intensity, you can see every single cycle is in fact generating an action potential. But once you increase the stimulus intensity above that level, you don't get any increase in firing rate. Okay, so this phase locking actually puts a limit on that firing of those neurons. That phase locking and activation and phase locking explains that abrupt onset and offset. Here's a neuron, a canal neuron, and this is the stimulus here, and you can see when the stimulus is turned on, you get vigorous firing. When you turn it off, it instantly goes back to the resting activity, and this is the plot of firing rate. That corresponds to the way vibration-induced nystagmus is activated at the onset of the stimulus and turned off at the offset. There isn't the kind of decay or reversal that you're familiar with so many other forms of nystagmus. This is different. And it's different because each individual cycle of the stimulus is generating this neural response. How can I actually relate that to nystagmus generation? Well, nystagmus is due to an asymmetry of average neural activity between the two nuclei. We showed that many years ago, and that's a basic clinical principle. So I represent the two vestibular nuclei like this. They've got about equal activity. You've got no nystagmus at rest. However, in someone who's lost one side acute unilateral loss, the activity on that side goes down, the activity on the other side goes up. We showed that donkeys years ago. And you finish up with quick phases away from the lesioned ear. This is for a simple unilateral loss. That imbalance is generating this quick phases away from the affected ear. Now, if you do the same kind of thing, but deliver now in a compensated person, but deliver vibration, it now enhances the activity on the remaining side, right? The side of the remaining labyrinth. And so there's an imbalance between the two sides, so you get quick phases away from the affected ear once more. Why is there no nystagmus when in healthy subjects? Because both labyrinths are activated about equally, and so there's no neural imbalance in the two vestibular nuclei, so the eye movements are effectively cancelled. Why is it horizontal and torsional but not vertical? Well, Cohen stimulated individual canals in cats and monkeys and looked at the eye movements. This is showing stimulating the horizontal canal, and you get eye movements in the horizontal plane. Single canal stimulation of the anterior canal causes upward and torsional eye movement. Single canal stimulation of the posterior canal causes downward and torsional eye movement. So when you stimulate them both together, the vertical components just cancel out, upwards and downwards, and you're left with just torsion. And I think that is why we see in these patients horizontal and torsion, because the verticals are cancelled, the horizontal is contributing, and the quick phases are away from the affected ear. I've shown the primary afferent responses explain many aspects of vibration-induced nystagmus. It's giving information about the balance in neural activity, and I draw your attention to my recent paper, which in fact goes into more detail and more explanation than I've been able to give you in this short presentation. I want to thank Georges Dumas, Liliana Sokolic, Anne Burgess and Julia Jelacek. Thank you.